Now the next question is about access opening. Okay, about access opening. The question is, which of the following agent is used for drying the floor of the pulp chamber before visual inspection of the root canal? So we studied the root canal system, the anatomy of the root canal system, but if you want to find a root canal system, what you have to do? You have to properly dry the chamber. Okay, pulp chamber has to be very dry. Okay, and you have to be, it should be clean. Okay, pulp chamber should be clean and dry. Okay, so what is the agent used? That's a question. Very simple question. So here 95% ethanol is the answer. Okay, 95% ethanol plus, now not just that, you also use 17% EDTA. So this is the agent you use together. So in this question there is only, they have given ethanol. Remember, the concentration is very important. It is not 70% ethanol which is used in your hand disinfectant and all, but here it is 95% ethanol and 17% EDTA. So once you put it there, the pulp chamber becomes clean and dry. Ethanol will evaporate and you will get a clean canal. Okay, so this concentration is important. Now similar question been asked next year, but then what they did was they slightly added something known as Stropco 27 gauge needle. There was nothing there. The question was same. Before inspecting the canal, the sequence of using the agent to clean and dry the floor of the pulp chamber is, answer is very, very simple. It is 17% EDTA and 95% ethanol. Okay, so the only thing they have added here to confuse you, this is very common. They'll give you some image, or they'll simply give you some description, but the question is very simple. And now I'm sure many students, I think this was the last year's question, so many students who wrote this answer to this question, they know that we sequentially use what, 17% EDTA and 95% ethanol, because of the previous year to that they asked this question, isn't it? So they know that answer is it. But now when they say this is a Stropco 27 gauge needle, they think that it is something different. No, it is same. This is how they confuse you. Okay, so now I have discussed in detail about how much questions to attempt in one of my lecture. Now imagine if someone thinks that I am going to omit this because I don't know Stropco, what Stropco is. So you have to take a little bit of chance. Okay, if you think that I'll answer only those questions which I'm 100% sure about, then you will hardly answer 180 questions, which is not at all sufficient, because a new pattern is that a little bit of thinking process, little bit of you're using your logic and all is very, very, very significant, because cleaning and drying, it is not going to be, what? It is not going to be hypochlorite, no doubt. Okay, and again, in this option also they have given a hypochlorite. In this option, the third option is the one which is correct. Here also there is hypochlorite. So basically hypochlorite you don't use to dry the canal. Have you ever seen a dry canal where you have used hypochlorite? No. So that is your logic. The rest all the things I have explained in detail in the how much questions to attempt. But now this is where you have to use your little bit of logic and thinking. And how does that come? Practicing more and more questions. Okay, practicing the test papers of the academy. Okay, now those who are going to write the exam, practice only the revision exams. Okay, revision exams, not the other ones. Okay, now anyway, so this is the Stropco gauge needle. Okay, Stropco needle, that is 27 gauge needle. So you attach it at the end of a 3-way syringe and you use it into the canal and just put it in the pulp chamber. You'll dry it. Okay. Now coming to the next question, the dye used in champagne bubble test. So what is basically champagne bubble test? So far what you did, you studied about root canal anatomy, you dried the pulp chamber, you cleaned the pulp chamber, now you try to locate the pulp chamber. You see that you try to locate the canal, you see that the canal is calcified. So in that case, when a canal is calcified, if you want to find out a canal, we use something known as champagne bubble test. Okay, that is champagne bubble test. What you do? You dye the pulp chamber with methylene blue. So I'm using the blue color here. Okay, you dye the pulp. You just put the dye 1% methylene blue. That's a question here. Okay, you put what 1% methylene blue, and once you put 1% methylene blue, then you fill the canal with hypochlorite. Okay, you just add hypochlorite here. and wait for 10 minutes. Okay, you wait for some time, okay, not even 10 minutes, you just wait for some time. What is going to happen is you see this bubbles out there coming from the canal, because you will see some dye penetrating into the canal, which will make it much more visible. Okay, and if the canal is there, which you have to negotiate the canal with using files only. If it's calcified, negotiation is by files only. But if you want to see it where exactly the orifice is going to be, then that can be seen that there is bubbles coming out from there. Okay, there is bubbles coming. Hypochlorite just gives off these bubbles from the canal orifice. Okay, and this, from there you can understand that there is canal in this location. You take the file, poke it there. Okay, you have to use the motions which we've studied, and you will see that the file going into the canal. Okay, now that's a different thing, how to negotiate a calcified canal. So what are the agents you're using? The dye you're using is definitely the champagne this methylene blue. And how much is the concentration? 1%. It can confuse you. They can confuse you by saying malachite. So someone who have not really understood or not really have put a little bit of effort to learning this, malachite or methylene blue in the exam. So make sure that you know that it's methylene blue, and it is 1%. It is not 2%, 5%, anything like that. It is 1% methylene blue. Now coming to the next question, champagne bubble test uses. So the first was methylene blue, second was hypochlorite. So this is where you use hypochlorite. So what did we do so far? For drying, we used ethanol, 95% ethanol and 17% EDTA. And then to calcify, or to locate the orifice of calcified canal, you are using 1% methylene blue dye and sodium hypochlorite. Okay, sodium hypochlorite. Usually 5.5% sodium hypochlorite. Now people unnecessarily worry about this hypochlorite accident beyond the limit. Yes, it's something which you have to be careful about, but too much of worry in that is not required. But especially when you're using it in the pulp chamber, anyway, it is not going to go beyond the apex. So you can use 5.5% hypochlorite, which is the most efficient concentration for root canal. Okay. Now you see that calcified canal and all you have negotiated, you find the canal anatomy was not two separate canal, it was a C-shaped anatomy. Okay, C-shaped anatomy, because you were doing root canal in which tooth? Mandibular, second molar. Why am I saying this? Because the tooth having highest number of C-shaped canals or highest frequency of C-shaped canals is most commonly seen in mandibular, very very important, mandibular second molar. Okay, mandibular second molar. Okay, the most commonly C-shaped canals are seen in mandibular second molar. This is followed by mandibular first molar. See this. So it's not the exact order what you have. No, second, first, second, third. No, it is second. That too mandibular second, mandibular first, mandibular third. So next is mandibular third molar. Okay, third molar. Now after this comes the maxillary. Okay, so maxillary. So maxillary again second molar, second molar. Now what about maxillary first molar? No, there is no such thing. Very frequent, it is maxillary third molar. Okay, then comes the mandibular premolars. Premolars. So it's mandibular again. So what did I say? All starts with mandibular second molar, most common. Then first, then third. Okay, then maxillary second again, but next is third, not first, mandibular premolars. Now let us come on to this question. In which of the following cases C-shaped canal is seen most frequently? So they're, instead of asking most common, they are asking the order. Okay, the previous year or previous years they have asked which is the most commonly seen. Most common in mandibular second molar. Now let us see maxillary second molar, mandibular first molar. How to answer this question? See the options first. Mandibular first molar, lateral incisors. So yes, definitely mandibular is more common. So that is where you have to focus on. Don't waste your time. This is how you save your time. Instead of going into all the descriptions, you know that it's a mandibular first, mandibular molar is more common. So what about mandibular? Is it mandibular first So both the cases mandibular first. Now see next. Mandibular third, mandibular second. Now it can never be this because mandibular second is much more common than the first. So yes, mandibular third is less common. Okay, hope you got what I'm saying. Mandibular first molar is more commonly have C-shaped canal than the third molar. Okay, and for second it is even most common. So this is the order. So they are asking here, this is what they are asking about, the first which is followed by third. First followed by third. Okay, not second. First is never followed by second. Second is most common. Okay, so this is how you have to answer the questions. Now your concept has to be very clear there. Now see, imagine I tell the students the last 3 days prior to the exam is very, very significant, and you are preparing for your last 3 days prior to the exam. If you have not touching this area while you are revising in the last 3 days, I've explained this in detail in my voice messages and as well as in my lectures. But yes, imagine if this area, and I've told you how to do that also, remember. So this area, if you're not touching in the last 3 days, you will never be able to answer this question, because definitely some confusions will come to you. Okay, saying that is it mandibular or maxillary? Is it mandibular first or mandibular third comes first? So this should not happen. Okay, now I'm going to discuss about the classification of C-shaped canals. Okay, C-shaped canal morphology. We said it's very common in mandibular second molars, followed by first and then third. Now, how do you classify it? What type of classification? So there are two classification systems which you have to know. One is Hau and Kim, H-A-U and Kim et al. Classification, where he have given 5 types. Okay, I'll just give it to you. That is 5 types of canal calcification. There is type 1, like we studied the previous one, 1, 2, 3, 4 and 5. Now what he said was type 1 is 2 or even more than 2 or 3 canals, but there is no communication between them. There is no communication at all. 2 or 3 canals, but there is no communication between them. Now whereas in type 2 there are 2 canals, and there is a communication between them, which might not be a true communication, but there seems to be a communication between them. True communication will come later on. That's 2. Now type 3 is easy, 3 canals. Okay, so type 1 is 2 or 3, but no communication at all. Type 2 is 2 canal with communications. Type 3 is 3 canals with communications. Okay, so that is, there is a communication between them. Type 4 is the canal extending into the isthmus. There is a communication definitely, but the canal is extending. The canal itself is extending, then there is communication below. You can see the canal itself is extending. And then type 5, there is the canal extends, and there becomes a true communication, throughout communication. Okay, so if they ask you the term here is throughout. They ask you throughout communication or true communication, then it is type 5. Okay, 2 or 3 canals. So starts with 2 canals, no communication, 2 with communication, 3 with communication, canal extending into the isthmus, and true or through and through communication. That is the classification of Hau and Kim. Okay, you have to remember this picture now. Very easy here. If you can remember these 2, what are they? 2 and 3. 2 and 3 is 2 and 3 with communication. 1 is no communication. And true communication, what comes in between? Isthmus. It's that the canal extends into its isthmus with a communication at the end. Okay. And now let us come on to the next one, that is Melton's classification of C-shaped canals. This one. Now understanding Melton's classification is very simple. So that is Melton's classification. There is, they call it as category 1, category 2 and category 3. The other one was 5. Okay, this category 1 means there's a continuous canal system. Okay, that's a continuous canal system. There is no separation. There is no dentine in between. There is continuous. Whereas category 2 is there is semicolon shaped canal system. You know what semicolon is, like this, isn't it? So that is okay. write it like this. Okay, when you write it in your, this is semicolon. So it's a semicolon shaped canal system with a distinct mesial canal. Okay, very distinct mesial canal, very clearly seen here. In the first case, can you differentiate between the mesial and distal canals in the first one? No, it's a continuous system. Whereas here you have got a distinct mesial canal with a semicolon appearance. That's category 2. Then category 3 is 2 or 3 distinct canals, which has no that semicolon appearance and all is not there, just 2 or more. Okay, there is a C-shaped system only. You look at a C, but there is no continuity one, and there is no that semicolon nature is also not there. So it's very simple between the two. So it all starts with 1. There is no communication at all. Then 2, 3. That is 2 and 3 with communication. This is continuous, and in between you have got extending into the isthmus. Whereas Melton's classification, it is continuous, semicolon, separate orifice without the above 2 features. Okay, so that was about the Melton's classification and Kim and Ho classification of C-shaped canal morphology. And remember this, mandibular second molar is the most common. Rest all it will come there. Okay, photographic memory, remember. Okay, no, I'm not writing it in detail of all these things, because you know that everything is there in your app, isn't it? In these questions are there, this description, this details, everything, this image, everything is there on the app. So that's why I'm not writing as such. I'm discussing it very quickly. Okay, so I'll end this session here. We'll discuss some more questions in the next class. Okay, till then, goodbye and take care.